Welcome back to our program, and we're talking with ear, nose, and throat physician Dr. Frank Brettschneider about sinusitis. Okay, what are the symptoms of sinusitis?
Okay. The symptoms can vary based on if it's an acute or chronic condition, but generally what most people complain of is nasal obstruction. They're congested, they have a hard time breathing. Often their drainage either out of their nose or down their throat is discolored. They'll sneeze because of the irritation from the lining of their nose. Facial pain, pressure, headaches are not uncommon, and many people will have bad breath. Sometimes they have a chronic bad breath condition if their sinusitis is a chronic condition. A cough from the postnasal drainage is not infrequent. General malaise, fatigue, just fever, chills. There's a whole host of different symptoms. People vary from person to person and what kind of symptoms that they exhibit.
Do people always know that they have sinusitis, or can you have a sinus infection and not even know it, because it sounds like the symptoms are pretty vague?
Well, if it's kind of an acute sinusitis, something that happens more quickly and more intensely, the symptoms are quite obvious with the facial pain and drainage and so forth. But people who develop chronic sinusitis can have it for years. I often will see people with many years of a constant postnasal drainage, constant throat clearing, constant nasal congestion. They're really not sure what's going on. They call it Michigan crud or Michigan sinus, and really what they're exhibiting is a chronic sinusitis. Symptoms aren't bad enough to be terrible, but not good enough to feel great either. They're saying some like sinus purgatory that just continues until they finally are motivated to seek treatment.
Are there risks to just not seeking treatment?
Well, you know, sometimes sinusitis can spread. Not commonly, but you can get meningitis, you can get orbital infections, you can get pneumonia, worsening asthma. So leaving it alone and not getting treatment does pose a little bit of a risk that it can worsen.
So would you advise, if you've got some of these symptoms you were talking about, even though they're not acute, you should see your physician? You
know, I think if the symptoms were persistent or they're bad enough to affect your quality of life, I definitely think you should. And we could always start with your family physician, your primary care physician. Let him or her assess you, see where you stand. Try some, medical treatment, some intranasal steroids to try to get the sinuses open and so forth and so on. That's always a good first step. Of course, if you fail medical treatment, ear, nose, and throat specialists are the next step.
So is the goal of treatment really basically to open those sinus passages?
Yes, if you can get them open, get rid of the inflammation, they'll start working, and usually your symptoms will resolve. It's the persistent blockage, persistent inflammation, and persistent infection that keeps these symptoms persisting.
What is the initial treatment?
I think antibiotics, intranasal steroids, maybe saltwater nasal irrigation, decongestants are helpful. Sometimes a mucolytic, something to thin the secretions, like a Mucinex can be helpful. Those are, some things are available over the counter. And then, of course, antibiotic and guided antibiotics with your family physician are good first-line treatments.
So if you've gone through the gamut and you're still suffering, what are some other treatment options?
Well, what we do after a long period of time when we're just not getting anywhere with medical therapy, the first thing we'll do is we'll image the sinuses. Sinusitis that doesn't resolve may require a CAT scan at the hospital. Sometimes we'll do allergy testing to see if we have an underlying allergy issue. But if you fail medical therapy and the workup helps guide us and we have a persistent infection, then really sinus surgery, which there's many different types of sinus surgeries, different options for us are a nice option to choose.
Well, that is a good time for us to take a break. Then we'll come back and we'll talk about some of those surgical treatment options.
Great.